I suppose the basics are looking at what issues you want to look at, whether you want to reduce, whether you want to stop. It's talking about, in a non-judgmental, non-shaming way, some of the things that you want to change.
It does focus on what an individual identifies as being problematic or difficult or challenging about their substance use or their relationship to substances, but it's also going to look at the other protective and risk factors that are in their lives.
And so usually seeing a drug and alcohol counsellor, they have a knowledge of drugs and alcohol, also a knowledge of what's around that stuff, whether there's, for some people it depends, what your background is, but you might have shame around some of the things you might have done. You might have gone into stealing.
So things that are going to contribute to them making good or, what they identify as bad decisions about their use, and helping them to set goals and work towards those on their own terms.
Usually a drug and alcohol counsellor has an understanding about all of those sorts of issues and works around that stuff, and then works on a plan with the person around how they want to reduce or change those behaviours and or their drug use.
But AOD counselling is not necessarily even going to look at reducing somebody's use unless that's something that they've identified that they want. So the outcome is to have a happier, healthier person who feels in control and in charge, and that may or may not relate to them reducing or abstaining from substances.
And really that therapeutic environment is one which I guess will bring out a lot of tears and laughter. It shouldn't, it'll be at times hard work, but it at times will also be really uplifting and helpful.
Where you might be heard for the first time and validated in your experience. Because I think it's really important to have that space where you feel heard and you can just put all your dirty laundry out and just go, it's asking for help, and hopefully you have a relationship with a counsellor that can guide you, and you set up goals together and you work together on that change. Whereas I know friends can be supportive, but they might not actually have the understanding and also the strategies and support that you might need to do those changes.